I'm Dr. Donna Volpitta, and I am the co-founder of the Mental Health Literacy Collaborative.
What inspired you to co-found the organization?
So, I have been talking about the need for mental health literacy for a very long time. I am an author in the space. My co-author, Jason Schofield, and I started writing and producing brain-based mental health literacy content in January of 2020, just after New York State had passed legislation requiring mental health education K through 12. But what we found was that there was a significant barrier between legislation and implementation. And in 2023, Annie Sleece reached out to us. We were introduced because Jason and I had done a presentation at Mental Health America conference, and we were introduced to Annie, who had just been very integral in passing legislation in the state of Delaware for mental health literacy education in schools. And she said, "This is great. You're from New York. I'm from Delaware. We just passed legislation mirroring the legislation in New York. Just tell us what you're doing and we'll just follow." And I said, "We're really not doing a lot. There's some teachers doing a great job of trying to get mental health education in schools, but as a state, there really wasn't a lot going on." And we were able to say really what was happening across the country. There was a lot of legislation being passed, but not a lot of implementation. So we started the Mental Health Literacy Collaborative to help people to move from that legislation to implementation.
How important is it for kids to understand their feelings?
It's interesting because feelings, when we talk about feelings, that's more social emotional learning,
Yeah.
and it's often people mistake mental health literacy for social emotional learning, and they are not the same thing. Mental health literacy is a missing piece of health literacy, and we know that health literacy is a huge indicator for people's health, that when we have high health literacy, we're able to take care of our health. But mental health literacy has been a missing piece of that. So, mental health literacy, and we have a very specific definition of it because there's a lot of research over the past 20 years about the benefits of teaching mental health literacy. And by that, we mean the framework, educational framework that teaches four things. The first is understanding how to maintain positive mental health. So, just like I know how to take care of my body, I know about nutrition, I know about exercise, I know about all of that, understanding how I can keep myself mentally healthy. And a lot of that has to do with the brain. How do we keep our brains healthy? And we have a lot of information about that. The second area is understanding common mental health disorders and treatments. So, just like I understand what diabetes is, I understand what strep throat is, I understand what cancer is, doesn't mean I can treat it, doesn't mean I can
Yeah.
diagnose it, but it means that I have a framework of understanding and I can talk about it knowledgeably. I know the difference between a stomach ache and stomach cancer. So, recognizing that. Um, and we want to have the same ability to talk knowledgeably about bipolar disorder or schizophrenia or um, uh, manic depression, all of these different mental disorders. And also to understand that there are treatments available for most disorders and that people can thrive and live very wonderful lives if they are diagnosed with mental health disorders. The third area is understanding how to seek help effectively. So, recognizing the signs and symptoms, getting help early, the importance of early intervention, and knowing who to go to ask for help and being able to access that. And the fourth area is understanding how to reduce stigma. And we always say if you teach the first three well, you're going to do the fourth, because just with that knowledge and understanding and having that language to talk about it, we are going to reduce stigma.
And I live with bipolar disorder too, so everything you said there, I'm like, yes, we need that. Yes, relatability.
Yes, because people just don't understand it, so they're afraid of it. And one of the things we find in terms of the barrier of implementing mental health literacy, we can have the legislation, but teachers are afraid because we didn't have it. It was missing.
No.
So we need to give, at the Mental Health Literacy Collaborative, we don't promote any particular curriculum. What we say is that people need to be teaching those 4 areas. That
Yeah.
when we have this information, which has been missing, it is something that we can that improves people's lives. And so we don't promote any particular curricula, but what we do is we've created something called Mental Health Literacy Aware, which is a very foundational program. It's 1 hour, asynchronous, available in both synchronous and asynchronous. And it just teaches people what mental health literacy is, why it's important, and how to bring it to their community. So it's just foundational to give them the confidence of this isn't therapy. You don't have to have clinical experience. You're a teacher, you're just teaching information.
Yeah.
Or a
What?
parent
Right.
teaching your kids. Like it can be anybody can teach this information if they're given the content.
Yeah, with parents,
Mhm.
how important is it for them to understand all these different subjects?
Absolutely. And we didn't have it. I'm a parent. We didn't learn this when we were young.
No.
So it's not anybody's fault. We just need to, and we actually started the Mental Health Literacy Collaborative. Our original mission was to make mental health literacy foundational in K-12 schools. And we soon realized that we need to make mental health literacy foundational in all schools and communities because everybody needs it. Nobody has it. Workplace, first responders, law enforcement, everybody needs this.
How does it feel for you to be bringing a positive message to people?
It has been incredible. It's funny because as I said, I've been talking about this for 14 years.
Yeah.
That's a long time. And people were not listening for a lot of that 14 years. And when Annie suggested that we start the Mental Health Literacy Collaborative, frankly, I was a very reluctant founder. I said, I don't think they're ready. I've been talking about this for so long.
Mm.
But she was absolutely right. It was time, and we have had tremendous response. It has been phenomenal, and I really believe that mental health literacy will be integrated in schools and communities. We're seeing a shift in the paradigm about how we look at mental health, which is so exciting.
I like what you said about communities because when I was diagnosed, I was 37 years old, 5 years ago, uh, and it was scary. No one really understood it, but I feel like throughout the coming years, more people are somewhat starting to understand it.
Absolutely. And there's so much more of a willingness for people to try to understand it,
Yeah.
and an openness to that, which has been wonderful. It really has. And I think that one of the biggest barriers is fear. People don't know
Mm.
it, so they're afraid of it. But when we can give them just a little bit of confidence, a little bit of this is what it is, it's not scary. It's just information. It's going to help you. It's funny because we always get from, people say, well, teachers have enough on their plate. We can't add something else. And we always say, you know what? It's on their plate already. They're hiding it under the potatoes because they're afraid of it. But we're going to give them the confidence to be able to address it so that they're not afraid anymore.
I like what you said with confidence is, do you see teachers' confidence rise in talking about this when they work with you?
Interestingly enough, we just launched that mental health literacy aware program. It's a 1 hour program. We just launched the one that's specific for educators. Our first program was general for anybody. But with teachers, we actually did a confidence survey prior to doing it and then afterwards. So all the survey was asking was how confident did they feel that they knew what mental health literacy is, that they could teach it in their classroom, and they knew where to access the content. And at the beginning, prior to taking the program, it was sort of 40, 45% confidence that they could do it. By the end of that hour, it was between 95 and 100%
Wow.
that people were like, oh, I can do this. This isn't scary. So that's what we're trying to do because there is a lot of fear, and understandably, because if it's something that they don't know, they never had this training. They never knew what this was about. So if we give them that confidence, they can do it. I have no doubt.
When I was looking on your website, I liked all the talk about empathy. Why is empathy so important in getting this information out?
Well, I think building empathy really helps us understand why we need that information. I
Yeah.
mean, empathy is just huge. When we have empathy for other people, it helps us want to work with them. And kind of fear is the opposite of empathy. So it's been exciting. It's been an exciting journey, and we're actually this Wednesday, so the day after tomorrow, we're launching our interstate work group. So one of the things we always wanted to do was to facilitate communication and collaboration between states because this is new. It's a change of
Yeah.
paradigm, and every state is dealing with it. We have other over 30 states now with some sort of legislation, but nobody knows how to do it. So we are launching this work group, and we decided to launch it about a month and a half ago, and we have 38 people, 38 states. Sorry, it's more than 38 people. We have about 70 people who have joined the interstate work group, representing 38 of the states. So in a month and a half, we've had 38 states say, yes, I want to be part of this. That's tremendous. Talk about a shift in the way that people look at this. It's been incredible.
And I also saw on your website you have a lot of advisors. What is it like working with all types of different people who believe in your mission?
We have had such tremendous support from our advisors because we have a very small team. We get a lot done.
Yeah.
We are a small but mighty team, but we really, really rely on our advisors, and we have a tremendous group, and they are always so supportive. In fact, when, as I said, I was a reluctant founder. When Annie suggested we start this, I said, don't think they're ready. And she said, let's try. Let's set up a phone call. And we set up a phone call on April 26th or 27th of 2023. And we invited 25 national leaders. 24 showed up and stayed on for an hour and a half. And all of them said, I want to be part of this. I will support you in any way that I can. Dr. Sharon Hoover, who's the head of the National Center for School Mental Health, was on the call. And she said, if you do this, you can launch as a pre-conference meeting to our National Center for School Mental Health conference. And Angela Kimball from Inseparable was like, I will support that. If you guys need funding to help do that meeting, we will do that. And everybody has jumped on board and said, this is one of the most important things that we can do to change. And Dr. Mark Weiss, who is also one of our advisors, and Dr. Britt Patterson, who's another advisor, just did they did some research on mental health literacy in Maryland and South Carolina, and they just helped to do a special issue of the Journal of I believe it's Journal of School Health. Um, there's going to be a special issue that was just published on mental health literacy in schools. So we're doing it. This paradigm is changing. We're getting mental health literacy into schools.
And I saw you have a youth advisory council. How does it feel for you to include the voice of teens and young adults?
You know, I have always been a fan of the importance of including young adults. I actually have four young adults of my own. I have a 17, 19, 21, and 22-year-old. And I have always been amazed at their ability. If we give young adults a chance, um, they have they can have tremendous impact. And all of the leadership of the young adult council have been advisors with us since the beginning, and they joined on and they said we want to launch the young adult council, and they are creating a toolkit specific to young adults. Um, so I believe they can, they're so passionate and they understand the need for this. And they want to help. They really do. They want to make an impact.
What have you learned from your own kids?
Oh my goodness, I have learned so much from my kids, and they're all so much different. But one of the things, it really gives me insight into their wanting to be taken seriously.
Yeah.
And that, you know, it's frustrating because they don't always feel like they're given a voice or listened to. And I think that it's really important that they have a voice at the table. And I fully respect all of my kids and their ability. They each have very different strengths, but I go to them for advice all the time.
What do you do to help your own mental health?
Oh, that's a good question after a week of Thanksgiving. I absolutely, we just had a family Thanksgiving, and I think one of the things I really do is I've looked at what are the things that really improve brain health. And so making sure that I'm connecting with other people, making sure that I take the time to exercise, to go outside. And I do a lot of walks outside, and that is sort of a really big thing for my mental health. And connecting, I think, with family and friends. I think those are probably the two most critical things for my own mental health.
And what would you say to anyone going through a tough time?
So I have two mantras that I use all the time. One is the serenity prayer. Recognize what you have control over and what you don't. And sort of, okay, trying to let go of that stuff and say, do I have control over this? The other is I'm on the board, and a very good friend of mine, Chris Waddell, has an organization called One Revolution. He was paralyzed in college and went on to become the most decorated male Paralympic skier in the world. And he has a program called Name Tags that he and I developed together. It's an education program. He goes to schools, and the theme of it is it's not what happens to you, it's what you do with what happens to you. So it's really built on resilience, that we all face challenges, but we have a choice as to how we respond. His organization is called One Revolution, and One Revolution stands for one revolution of his hand cycle, which he used to climb Mount Kilimanjaro. And he said that it took about 536 revolutions for him to get to the top. And every revolution was a choice. Every time he turned that hand cycle, he had to choose whether to go up or whether to stop and go down. And so his one of the things he and I say to each other all the time is one revolution at a time, just one revolution at a time. And that's one of my biggest mantras. So sort of understanding what we have control over and what we don't. And the other one is one revolution at a time. There's a lot of different stuff going on, and you can only handle one thing at a time.
Where do you want to see your mental health mission in the next 3 to 5 years?
Gosh, I would love to see mental health literacy everywhere. Like, I
Yeah.
would just like to see it integrated not only in the US, but globally. There is an appetite for this everywhere. I'm on the mental health initiative of the Global Wellness Institute, and I've talked to people all over the world about this, and they know that we need to be proactive. We often say that the way that we treat mental health is like Smokey Bear teaching us how to put out forest fires, but not how to prevent them. And we need to go upstream, go prevention. And so there is a change in the way that people are looking at this, and I'm so excited about it.
How can people reach out and learn more?
At www.themhlc.org. So the Mental Health Literacy Collaborative, the mhlc.org. We have a free toolkit on there. We have all of our initiatives that are laid out. We just, particularly pre-service educators, we just were announced as a Clinton Global Initiative commitment to action. So we've committed to certifying 30,000 degree-seeking educators over the next 3 years, cost covered for the mental health literacy aware. So they can learn about that. And we have a lot of stuff going on.
Yeah.
So, and it's all covered in the on our website, and they can reach out if they have any questions.